Goeienaand julle, dis vir my so lekker om net weer vanaand met julle te gesels. Ek het nou vir die laaste 2 weke het ek vir julle vertel van hierdie groot onderhoud wat ek gaan voer vandag. So ons gaan dit in 2 sarsies doen. Eerstens gaan ons vir Martinus, wat julle sy gesig nou sien, gaan ons vanaand weer 'n bietjie praat en dan gaan ons net 'n volgende geleentheid gaan ons met die Dr. Pauline praat. So vanaand praat ons oor met Martinus. Martinus is die skrywer van die boek Lewe in Oorwinning, 'n reis deur Openbaring. En as jy nog nie van die boek gehoor het nie, wil ek jou regtig aanmoedig, gaan kry vir jou die boek, koop hom, hy's beskikbaar op Kobo, en ek is seker Martinus sal vir julle sê waar is hy nog beskikbaar. Ek het hom daar gekoop, en dit is vir my altyd so lekker, as ek en Cecile met mekaar praat oor wat die skrif is, dan sê ons altyd, wat sal Martinus nou sê oor hierdie stuk, want hy het altyd 'n unieke manier om na die skrif te kyk. So Martinus, baie welkom. Dankie dat jy jou tyd uitgesit het om vanaand met ons te gesels, en ek is seker jy het baie waarhede wat jy met ons wil deel vanaand.
Ja, dankie Phillip en ook vir die mense wat hierna luister. Ek dink dit is so belangrik dat om jou vragie te antwoord oor die boek van Openbaring, dink ek die begeerte is juis om ouens net te bemagtig met die woord en net myself te help om te sien hoe kan ek die woord meer lees rondom dit, net om jou vragie te antwoord, want ek is bang ek vergeet. So as die ouens die boek wil hê, is hulle welkom om met jou te gesels en dan kan julle sommer deur Phillip werk en dan kan ons vir julle die boek beskikbaar stel. Andersins is jy welkom op my website te kyk, martinussteffen.co.za, en dan kan jy ook die boek daar bestel vir die ouens wat graag dit as 'n harde kopie wil hê.
Baie dankie Martinus. Nou vanaand gaan ons nie noodwendig net oor die boek van Openbaring praat nie, maar daar's 'n groter gesprek wat nou besig is om sy kop uit te steek, en ek dink die kop is al ver uit. En vanaand gaan ons net begin deur om hierdie gesprek bietjie verder te vat. Ek dink as ek en Martinus vanaand hier praat, kan ons sê ons is net deel van die gesprek. Ons gaan julle nooit sê wat om te doen, en die antwoorde wat ons gee is nie 'n absolute ja of nee nie. Ek dink jy moet altyd teruggaan en vir jouself besluit. Wat is die regte antwoord vir jou, en gaan bid daaroor en hoor by die Here. Ek sê altyd vir julle, hoor by die Here, wat sê die Here, wat praat die Here in jou hart met jou oor hierdie ding? Nou ja, die tema in die gesprek wat ons vanaand gaan oopmaak, gaan oor Covid-19. Nou Martinus, ek het vir die gemeente en die gemeenskap gevra om vir my so 'n paar vragies te gee, en ek dink die vraag wat jy vanaand gaan hoor is niks niets nie. Dit is al vrae wat deur honderde, miskien duisende mense gevra is, maar ek gaan vir jou die 4 vrae vra, dan gaan ek die vloer vir jou gee, dan kan jy regtig vir ons van jou perspektief af sê, wat sê die skrif hieroor, wat sê die Bybel, en wat is die hart van God rondom hierdie dinge? So die eerste vraag wat ek gereeld hoor by die mense is die inenting, die vaksin, die merk van die dier, en gaan ek hel toe as ek die inenting kry? Dan 'n volgende vraag wat saam met die eerste vraag gaan, is dit vir my as kind van die Here eties reg om die vaksin te kry? Nou as ek die vraag vra eties reg, vra ek die vraag uit die punt van uit. Die ouens sê Big Pharma is uit om geld te maak, so is dit vir my as kind van die Here reg om hulle ryk te maak deur om die vaksin te vat. En dan, watse koneksie het die inenting met die Bybel, en hoekom gaan die Bybelse profesie teenoor die eindtyd laat realiseer as dit gaan, soos byvoorbeeld nou die wegraping wat almal van praat, wat hulle so verwag, en wanneer gaan dit gebeur? Want daar's mense wat sê dit gaan binne die volgende 6 maande gebeur. En dan die laaste vraag wat ek vir jou wil vra rondom hierdie dinge is, watse raad het jy vir ons rakende die versprei van vals nuus en van al hierdie sensasiesoekende video's wat so op Facebook en op YouTube versprei word? Hoe fact-check jy hierdie dinge? En wat sal jy sê, moet ons voor pas op, en wat is die rigting wat ons moet ingaan? Nou dis die 4 vrae wat ek het. Die vloer is joune, jy is welkom.
Dankie Phillip, ek dink dis baie diep vrae. Ek dink is goed dat ons baie mee stoei. En ek dink een van die goed wat ek dink verskriklik belangrik is, vra ek altyd vir mense, maar hoe kyk jy na die wêreld? So ek het vir ons so net 'n paar slides voorberei. So ek wil vanaand sommer daar begin En wanneer ek daar begin, dan sê ek, dit is so belangrik dat ons sal besef, dat hierdie goed waaroor ons gesels vanaand, dink ek, moet ons eers begin by die regte vraag. Ons het so rukkie terug ons afgeskop met iets wat ons met mense doen om hulle toe te rus om effektief te wees in hierdie wêreld. En ek dink vir almal van ons gaan oor hoe kyk ek na die wêreld. So wanneer ons dink aan die wêreld, dan dink ek eerstens voordat ons hierdie vraag kan antwoord, moet ons vra deur watse bril antwoord ek en jy die vraag. So vanaand wanneer ons daaroor gesels, dan wil ek graag net 'n paar riglyne gee om jou te help hierdie vraag te antwoord. So wanneer ons hieroor gesels, dan sê ek, okay, wêreldbeskouing is hoe ek en jy kyk na die wêreld. Nou, as ek en jy groot geword het in 'n sekere omgewing, dan het dit 'n invloed op ons lewens. As ek en jy groot geword het in 'n sekere kerkomgewing, het dit sekere invloed op my lewe. So ek dink dis baie belangrik om hierdie vraag eers te antwoord voordat ons die vraag oor vaksines, voordat ons die vraag oor die eindtye, voordat ons enige van daai vrae antwoord. So ek dink die belangrike ding wat ons vanaand wil vir mekaar sê is, hoe help ek myself om dit te doen? So, wanneer ek met mense praat daaroor, dan sê ek hierdie is verskriklik belangrik. My fokus moet reg wees. So wanneer ek die Bybel lees, dan dink ek die Bybel het twee komponente. Die eerste komponent is, die Bybel gee vir ons 'n sekere inhoud, maar daai inhoud is aan my en jou gegee in 'n sekere konteks. So ons het nodig om daai twee goed te antwoord. En ons het nodig om te weet dat die Bybel gaan oor Jesus en Jesus gaan oor my en jou. So wanneer ons daaroor gesels, dan dink ek dit moet ons vertrekpunt wees. So om mense te help om voordat ons die vraag oor al hierdie ander goed antwoord, moet ek vir myself vra, wat is my wêreldbeskouing? En hierdie raamwerk help my baie keer om net daai vraag te antwoord. So wanneer ons daaroor gesels, dan sê ek, okay, maar ons het eers nodig om te vra, wat is die absolutes? Wanneer ek met enige vraag werk, wat is die absolutes? Wanneer ons praat oor absolutes, byvoorbeeld, kom Jesus terug? Dis 'n absolute. So die interpretasie daarvan is, kom hy terug, gaan ons hemel toe, kan ek my hondjie saamvat hemel toe? Ons kan dit op verskeie maniere interpreteer. Gaan die Here kom voor die 7 jaar van verdrukking, na die 7 jaar van verdrukking? Hoe dink ek oor al daai goeders? So daar's verskeie interpretasies van hoe mense met die woord werk en na die skrif kyk, om daai goed te kan antwoord. En dis 'n interpretasie, dis nie 'n absolute nie. Die absolute is, Jesus kom terug. Dis 'n feit. Dis die absolute. En dan gaan ons 'n stapie verder deur te sê, okay, ek neem aan as gevolg van my bril wat ek op het, neem ek aan dat ons het twee skatties, Kouke en Fats. So as Kouke en Fats doodgaan, dan neem ons aan Kouke en Fats gaan saam met ons in die hemel wees. Dis 'n aanname. En ek dink baie van die goed wat ons mee vandag oor praat, kan lê, ons moet die vraag vra, lê dit in 'n absolute waarheid, 'n interpretasie, of is dit 'n aanname? Neem ek aan 'n klomp goed wat ek het goed oor die radio gesien of geluister, ek het goed oor die TV gesien, ek het Facebook gelees. Daar's soveel verskeie goed waarna ons kyk. So ek het nodig om vir altyd, wanneer ek hieroor praat, dan sê ek, okay, wat's die absolute in hierdie vraag? Is hier 'n absolute? Of is hierdie 'n interpretasie van iemand anderste? Is hierdie 'n aanname? Want wanneer ons na die skrif kyk, dan dink ek hierdie is 'n verskriklike belangrike raamwerk. Dit help my om te fokus. Want die Bybel gaan vir my oor Jesus. En Jesus gaan vir my oor my en jou. En hy sê, weet jy wat, die skrif is juis gegee vir 'n rede, en ons gaan nou daarna kyk. Ek dink die tweede ding wat ek dink baie belangrik is iets wat ek dink baie bekend is in ons omgewing. En wanneer ek met mense werk, dan sê ek altyd vir mense, ons het 'n sekere ysberg beginsel. So baie keer kom mense na my toe, dan sê hulle, Martinus, ek wil graag weet, hoe moet ek hierdie hanteer? Vertel my net, en ek glo Phillip, jy beleef dit ook. Vertel my net, hoe moet ek my vrou beter bestuur? Vertel my net, hoe moet ek my finansies beter bestuur? Vertel my net, hoe moet ek die Here beïndruk? Vertel my net, en dit gaan juis oor my gedrag, hoe ek optree, hoe moet ek leef? So, maar dit word gebou op wat ons sê my en jou waardes is. En wanneer ons praat oor waardes, het elkeen van ons het 'n sekere huisopset, saam met jou kinders doen jy sekere goed, maar hoe jy jou kinders grootmaak, hoe ek my kinders grootmaak, is verskillend, want ons waardesisteme verskil. En daai waardesisteem gaan oor, wat is goed vir my? En dis daai vraagie wat ons afvra, so jou waardes kan verskil van my waardes, maar ons waardes word baie keer gebou op ons geloofsoortuigings. Dit beteken, wat is vir my die waarheid? Wat vir my die waarheid is nie noodwendig vir jou die waarheid. So jy kan anders daaroor dink, maar dit is vir jou anders, want jy voel anders daaroor, jy beleef goed anders daaroor. Maar ons het eintlik nodig om die vraag te vra en te vra, wat is die waarheid vir God? Wat is vir hom die prioriteit? En soos wat jy in die begin van hierdie sessie daaroor gepraat het, was dit vir my so lekker om te hoor, dat jy altyd sê, ons het nodig om by die Here te begin, by die Here te praat, want ek dink dis ons vertrekpunt. Ons het nodig om onsself in Christus te sien. Wanneer Paulus met ons praat, ons skryf in die boek van die Efesiërs 27 keer, ons het nodig om te besef, ons is in Christus. Dit is verskriklike belangrike woorde vir my en jou, as ons onsself sien as kinders van die Here. Waarin hy sê, jy het nodig om te ontdek, wat is jou identiteit in Christus? So ek dink, die absolutes, interpretasies en aannames, is hoe ek my vrae evalueer in die lewe. Die tweede element is, waarop ek my waarheid bou. Wat is die waarheid vir God? So, ek dink is so belangrik, dat hy altyd terug moet gaan na die Here. Maak nie saak wie wat sê nie. Ons het nodig om terug te gaan na die Here, en seker te maak, dis ons fokus. So, wanneer ons na die skrif kyk, om hierdie vrae te probeer antwoord, dan dink ek, hierdie is vir my verskriklik belangrik, en wanneer dit kom by om ons Bybels te lees, dan dink ek daar's 3 bewegings in die skrif, wat ek dink verskriklik belangrik is. So wanneer ons van Genesis tot Ester op sekere van die elemente fokus, dan dink ek, dit gaan baie oor daai element van, ek het nodig om te verstaan, hierdie is die geskiedenis van die volk van Israel, op daai stadium God se volk. In die geskiedenis, die wet is gegee om te wys hoe dit en ter voorbereiding van 'n gemeenskap is, wat die openbaring van Jesus Christus kan ontvang. Dan sien ons die wysheidsliteratuur, dit is Job tot Spreuke, en ek onthou op universiteit, het ek die wysheidsliteratuur bietjie bestudeer, om te sien hoe die ouens daarmee stoei, en hulle verhouding met die Here word daarin verduidelik. En dan het ek nodig om te weet, daar's 'n klomp elemente, veral in die Ou Testament boeke, en die res van die Ou Testament, gaan oor juist die implikasie wat verwag was, oor Christus wat sou kom, die profete en hoe ons dink daaroor. En dan sien ons die 4 evangelies waar Jesus as die voorbeeld vir my en jou kom. En dan kry ons die briewe, wat dan baie groot gedeeltes is van die verdere Nuwe Testament, my en jou deelname in Christus. So hier's 3 brille wat ek dink verskriklik belangrik is, van ek besef, nou die dag lees ek op Facebook weer van iemand wat hieroor praat, en dit gaan eintlik oor ons wêreldbeskouing, oor hoe interpreteer ek hierdie goed, want ons koppel baie keer goed wat ons nou sien, aan goed wat ons eers gehoor het, of eers gesien het. Maar ek het eintlik nodig om na die skrif toe te gaan, en te vra, watter bril het ek op? So hier's 3 brille wat verskriklik belangrik is. Die eerste bril gaan oor, ek het nodig om te verstaan, dat die Ou Testament, wanneer ons praat oor die Ou Testament, dan praat ons daai ter voorbereiding van Christus wat sou kom, sodat ek en jy, die kruis was juist daai oomblik, waarin ek en jy op die plek gekom het, waar ons besef het, hier het 'n transisie plaasgevind, ons het nie nodig, ons is nie meer in ooreenkoms met die Here nie, maar 2 Korintiërs 5:17 sê, ons is nou van 'n nuwe spesies. Johannes 3 sê dit so mooi, veral in die boodskapvertaling sê dit so, hy sê, we are born from above, not below. En dis daai elemente, dis konsepte, wêreldbeskouings wat ek nodig het om te verstaan. En te verstaan, Jesus kom in die 4 boeke waar hy oor praat, en hy praat oor daai elemente van Matteus, Markus, Lukas en Johannes, praat hy juis oor 'n voorbeeld wat hy kom skep vir my en jou. Maar nou leef ek en jy in die realiteit van die Nuwe Testament. Nou, die Ou Testament het gegaan oor 'n ooreenkoms. Die Griekse woordjie wat hy daar gebruik, praat van 'n ooreenkoms. Maar wanneer hy praat in die Nuwe Testament, en hy praat van 'n nuwe verbond, dan praat hy van die woordjie diafykeit, wat beteken dat iemand het gesterf namens my en jou, en ons is nou ingesluit in Christus. En dit is veronderstel om ons perspektief te wees. Dis hoekom in Christus so verskriklik belangrik is. Nou, hoekom is hierdie belangrik? Want wanneer ek hierdie verstaan, maak nie saak waar ek die Bybel lees, en ek trek dit altyd deur om dit te reflekteer in Christus, want dit is baie belangrik om te weet, dat die openbaring van Christus, dit is wat Jesus self sê in Johannes 5, hy sê, julle ondersoek die skrif, omdat julle dink, dat julle die ewige lewe daarin kry, en dit is juist die skrif, wat oor my getuig. Tog wil julle nie na my toe kom nie, sodat julle die lewe kan kry. Dis Jesus wat besig is om te praat, en hy sê, ons, dit is so belangrik, dat julle dit sal verstaan. En Lukas 24 vers 27 is so belangrik, hy sê, daarna het hy by Moses en al die profete begin, en al die skrif uitsprake wat op hom betrekking het, vir hulle uitgelê. So ek dink is so belangrik, dat ons vertrekpunt van hierdie goed moet weet, wie is Jesus Christus. En ek hou so baie van wat Romeine 10 vers 17 sê, hy sê, julle het nodig, en veral in die Amplified Bible sê hy, you need to live according to the words of the revelation of Christ. So ons het nodig om ons self te sien, ons het nodig om te verstaan, dat die woord gaan oor Jesus, en Jesus gaan oor my en jou. En die Bybel moet ek eintlik gebruik, om seker te maak, dat ek absoluut in verhouding met Christus leef, en ontdek wie ek is in Christus. En wanneer ek dit verstaan, dan spreek ek al die ander goed af. Want hy is die absolute, hy is die konstante, hy is die een wat die heeltyd, elke area van my lewe kom deurweek. En alles wat ek meet in die lewe, moet ek eintlik meet aan hom. So ek dink, dit is so belangrik om daai goed net vas te maak, en dit te weet in my lewe, voordat ek al hierdie vrae kan antwoord, het ek nodig om hierdie fondasie te lê. So, daai openbaring is verskriklik belangrik, want Jesus het met die fariseërs daaroor gepraat. Hy sê, ouens, ek wil net vir julle sê, julle soek my oral, maar julle kry my nie. And it's all about Christ. So, ek dink, dit is vir my 'n verskriklike belangrike vertrekpunt, wat ons nodig het om vanaand vas te maak, wanneer ons praat oor al hierdie vrae. So, die vraag is, hoe interpreteer ons dan vanuit daai raamwerk die Bybel? Want ek onthou een van my geestelike vaders het altyd vir my gesê, hy sê, Martinus, is so belangrik, ons vra baie keer, Here, hoe pas ek in hierdie prentjie? Maar eintlik het ons nodig om te vra, wie is God? Wat het Jesus met my nou kom doen? Hoe gebruik ek die woord, sodat ek sy lewe, sy plan, sy perspektief kan uitleef? So wanneer ons die skrif gebruik, dan het ons nodig om te verstaan, dit is eerstens 'n historiese konteks van uitleg, en dan tweedens is dit 'n progressiewe perspektief om te sien hoe God homself openbaar aan die mens. Nou, wanneer ek dit sê, dan sê ek altyd vir mense, ons lees van 2 verbonde in die Bybel, omdat ons so groot geword het. Ons lees van die verbond, wanneer ons daaroor praat, dan praat ons van die wet van Moses, en dis eintlik 40 jaar van die Bybel, terwyl die Bybel ontwikkel het oor 2.500 jaar. En dis baie keer ons fokus, want dis hoe ons groot gemaak is. Die ander kant is jy die nuwe verbond, dit wat Jesus kom inby het, en dit wat hy gesê het, ons nodig het om te ontdek. Dis die Nuwe Testament. Hy het gesterf sodat ons kan erf. Maar wanneer jy die skrif lees, dan was daar 'n verbond met Aram gewees, want daar's 'n bokkie geslag, of sodat hulle self kon bedek. Daar was 'n verbond met Noag gewees, daar was 'n verbond met 'n klomp goed, en dis 'n ander gesprek. Maar ons het nodig om te verstaan, wanneer hy sê, God openbaar homself progressief, dan elke verbond was uniek met elke mens in die Bybel en in daai tyd. En hy is besig om homself die hele tyd konstant te openbaar. Ek het net nodig om myself te vra, hoe sien ek myself in daai openbaring? So dit is baie belangrik dat ek dit sal weet, wanneer ek na die skrif kyk, en die Bybel interpreteer. Want dit wat vir Job gegeld het, dit wat vir Noag gegeld het, dis 'n ander konteks, dis 'n ander agtergrond, dis 'n ander perspektief, en ek het nodig om daai goed in ag te neem, as ek wil leer uit hulle lewens. So ek dink dit is verskriklik belangrik wanneer ons daarna so kyk, net om daai pen in te slaan wanneer ons die skrif interpreteer. So, waar begin ons dan? Want dit is eintlik die vraag. Okay, Martinus, ek hoor al die goed wat jy sê, maar waar begin ons? Want dis brandvrae wat ons moet antwoord. So eerstens, elke deel van die evangelie is eenvoudig. As dit te ingewikkeld raak om te verstaan, is ons heel waarskynlik besig om dit verkeerd te interpreteer. So ek dink dis baie belangrik dat ons sal verstaan dat die evangelie is goeie nuus. As dit nie goeie nuus is vir my en jou nie, is dit nie goeie nuus nie. Dis wat die skrif ons leer. Hy sê dit moet vir almal goeie nuus wees. Ons het die beste nuus ooit. En almal moet daai voorneem. Tweedens, ons perspektief oor die toekoms is nie veronderstel om ons vreesagtig te maak. Dit waarmee ons besig is goeie nuus. So, dit is ook die belangrike vraagie wat ons moet vra, wanneer ons praat oor al hierdie verskillende goed, wie maak geld, wie maak nie geld nie. Wat is jou perspektief van die toekoms? Vir my is dit verskriklik belangrik om te verstaan dat my eerste prioriteit, die absolute vir my is, ek het nodig om in verhouding met die Here te leef. Dis vir my absolute. Want wanneer ek transisie van hierdie wêreld, gaan ek vir ewig saam met hom leef. En die einddoel van my lewe is verhouding met God. Dis die einddoel van my lewe. So ek wil dit net vanaand sê, want ek dink dit is so belangrik, dat mense dit sal raak sien. Dan derdens, ons verstaan van die eindtye bepaal hoe ons leef vandag. So as ek leef met hierdie vrees, dan is dit heel waarskynlik, en ek sê altyd vir ons, dit is so belangrik om te weet, as jy die hele tyd leef met vrees in jou lewe, het jy nodig om te weet, dat vrees is soos 'n self-fulfilling prophecy, as ek die Engelse woord kan gebruik. Dit dat jy vrees, dit kom uiteindelik oor jou. So ek dink dit is so belangrik om te weet, dat ons nodig het om ons fokus op Christus te hê, die goeie nuus, in plaas van die vreesagtigheid. Want 2 Timoteus 1:7 sê hy sê, God het ons nie 'n gees van vreesagtigheid gegee nie, maar van krag, liefde en selfbeheersing. Ek dink dit is so belangrik dat ek altyd daai perspektief sal behou wanneer ons oor van hierdie goed praat. So, en hierdie is baie belangrik, dit maak ons vry van vrees en help ons om passievol te wees oor Christus in ons en nie obsessief te wees oor die anti-kris of die uitdagings van die wêreld om ons. So ek dink dit is baie belangrik dat ons dit sal verstaan, want hoe ek kyk na die wêreld, my wêreldbeskouing, watter bril ek op het. Wanneer ek daarna kyk, het ek nodig om te verstaan, as ek nie 'n positiewe uitkyk het op die toekoms nie, bepaal dit hoe ek vandag gaan leef. En ek dink dis vir ons baie keer ons issue. So die Bybel is geskryf op 'n sekere manier, in 'n sekere konteks, plek en tyd. En ek het nodig om al daai elemente in ag te neem, wanneer ek daarna kyk. So, net om bietjie van die fondasie rondom dit te lê. En ek dink net, wanneer ek na die skrif kyk, dan is hierdie vir my so 'n sleutel skrifgedeelte. Want die Romeinse skrywer help ons om te verstaan, ons het eers in sonde geleef, en hy verduidelik dit verskriklik mooi, en dan transisie hy na Romeine 8 toe, waar hy eintlik hierdie verduidelik, hy sê, daar is dan nou geen veroordeling vir die wat in Christus Jesus is nie. Ek en jy is vrygekoop van God se straf. Dis wat hy verklaar in Jesaja. Ons is vrygekoop van dit. Wanneer hy daaroor praat, dan sê hy sê, alle straf is op Christus geneem. Dit is so belangrik dat ek sal verstaan, dat wanneer ek daarna kyk, dan is hierdie 'n sleutel skrifgedeelte, want hy sê, want as ten gevolge van die misdaad van die een, die dood geheers het deur die een, veel meer sal hulle wat die oorvloed van die genade en van die gawe van die geregtigheid ontvang, in die lewe heers deur die een Jesus Christus. En dis vir my 'n sleutelskrifgedeelte, want hy sê, dit was Adam, wanneer hy verwys na die ten gevolge van die misdaad van die een, praat hy van Adam, en dan wanneer hy sê die dood geheers deur die een, veel meer sal hulle wat die oorvloed van die genade in Christus Jesus raak sien, ek en jy, dan sê hy, jy sal heers in hierdie lewe. Nie eendag nie. Jy gaan nie eendag heers nie. Jy gaan nou. En dis verskriklik belangrik. So wanneer ek na enige van hierdie vrae kyk, moet ek verstaan, ek sit saam met Christus in hemelse plekke, sê Efesiërs. Nou, wanneer hy daaroor praat, dan sê hy sê, wanneer hy in die Efesiërs verwys na hemelse plekke, dan praat hy van die plek waar God regeer. In die oorspronklike konteks beteken die plek waar God regeer. So ek kan alreeds in hierdie lewe heers, in daai perspektief. So ek moet eerder vra vanuit 'n plek van posisie, Here, hoe spreek ek hierdie goed aan? Hoe kyk ek na hierdie goed? Want baie keer stoei ons met hierdie ding, ons voel ons is, as ek die Engelse woord kan gebruik, victims, van omstandighede en situasies. Maar eintlik het die Here ons geset op, geposisioneer in hom. En ons het nodig om vanuit 'n heerskapy perspektief en bril na die wêreld te kyk en daai goed aan te spreek. So ek dink dis verskriklik belangrik dat ek dit sal verstaan, want as ek 'n heerskapy bril op het, dan kyk ek anders na die wêreld. Dan weet ek, Christus het klaar die duiwel oorwin. Dan weet ek, daar's 'n klomp goed wat besig is om te gebeur. En ek het nodig om te vra, wat is die konteks en wat is die goed wat ek nodig het om daar vas te maak? So wat is dan my perspektief oor die boek van Openbaring? Want baie van dit wat jy vanaand vra, word gekoppel aan daai perspektief. En ek wil nou nie deur alles lees hier nie, maar hier is verskillende perspektiewe, net om te sê, daar's 9 verskillende teorieë oor die boek van Openbaring. Hier's 4 verskillende perspektiewe wat N.T. Wright oorskryf. Maar wanneer ek kyk na die boek van Openbaring, dan sê ek, ouens, ons het nodig om te verstaan, die geskiedenis kan homself herhaal. En ons het nodig om te weet, dit wat gebeur het, die eerste Holocaust verwys ons altyd na die Jode, en ons verwys altyd na Hitler. Maar die eerste Holocaust in die skrif was nie dit nie. Die eerste Holocaust in die skrif het plaasgevind deur generaal Titus, wat van Rome afgetrek het, en sover as wat hy gegaan het daar meer as 1 miljoen Jode gesterf op pad Jerusalem toe hulle Jerusalem moes in besit neem. Dit was die eerste Holocaust. So wanneer ons daaroor praat, dan het ons woordeskat gekoppel aan dit. En daar het meer as 1 miljoen Jode gesterf. Net soos wat eintlik van die geskiedenis homself herhaal het, wanneer ons kyk na Hitler se storie. So dis baie belangrik, dat wanneer ons daarna kyk, dan sê ek, wanneer ek na die boek van Openbaring kyk, dan kyk ek na beginsels en dinamika, en ek leef in verhouding met die Here, en ek verstaan, dat die geskiedenis homself kan herhaal. Dit wat ons beleef met hierdie pandemie, is nie die eerste keer nie. 100 jaar terug, het ons pokke gehad. Mense moes deur mediese ervarings gaan, sodat ek en jy vandag, of toe ons kinders was, inentings kon kry vir pokke. So hulle het deur dieselfde proses gegaan. Wanneer jy gaan terugkyk in die Bybel en die geskiedenis rondom dit, dan kom jy agter dat Rome op 'n stadium het meer as 3/4 van hulle ryk verloor as gevolg van pestsiektes. Hulle moes deur daai selfde fase gaan. So geskiedenis herhaal homself, want ons leef in 'n gebroke wêreld. Totdat mense wat hulle self in Christus sien, die lig bring daar waar daar duisternis is. Dis waarvoor die Here ons gemaak. Dis waarvoor die Here ons gemaak het. Is sodat ons duisternis, waar ons duisternis sien, het ons nodig om lig te bring. Daar waar ons sien, met al die goed wat in Suid-Afrika gebeur, is dit juist die kerk wat moet by mekaar kom. Is dit juist die kerk wat moet opstaan. Met al die goed wat ons in Durban die afgelope tyd gesien het, is dit juist die kerk wat hande vat oor grense heen, om te sê, ons het nodig om iets van hierdie te bring, soos wat Paulus gesê het, ouens, die mense in Jerusalem is arm, hulle het nodig om almoes te gee. Net so het ons iets van daai beweging van God se liggaam gesien. En ons het nodig om dit in ag te neem. So dan om by jou vraagie te kom, wil ek graag dan net vanaand, een van die kerkleiers het hierdie geskryf, en ek wil dit graag lees. Veral in die lig van wat ons die afgelope tyd beleef het met verskillende posisies, veral in die kerk ook, oor hoe ons daaroor dink. Skryf dit so, hy sê, the fact that a church is divided and its position towards vaccination has also not been helpful. We can have a measure of sympathy with people who feel that a vaccination had not yet been tested in terms of its possible side effects, dis waar. But side effects from using medicine is not new. Countless people live with side effects from the pharmaceuticals they take. Some are trivial, while others are almost as bad as the illness or disease itself. However, the reality of the devastation the pandemic is causing is reason to believe that taking the vaccination is in essence taking the high road for the sake not only for yourself, but as a contribution to secure the possible end of this pandemic spreading rapidly and rampantly across the globe. We are literally being asked to make a sacrifice for the well-being of our neighbors. And making sacrifices for the benefit of others is exactly what Christians are called to do. A strong word of caution is to be issued to those who are using any biblical reference to discourage vaccination. This is to be seen as bad and unhelpful exegesis of Scripture. So wanneer ons praat oor exegesis, dan praat dit oor die uitleg van die skrif of die interpretasie van die skrif. So ek dink is so verskriklik belangrik om dit te verstaan. En ek stem 100% saam met wat ek hier lees, vir die eenvoudige rede wat ek verstaan. Mense het verskillende persepsies oor verskillende goed. My vraag is, wat is jou wêreldbeskouing? Die tweede vraag is, sien jy jouself in Christus? Want as jy jouself in Christus sien, dan het jy en die Here nodig om hierdie saak uit te klaar. En jy het nodig om 'n besluit daaroor te maak. En ons het so belangrik, dit is so belangrik om te verstaan, dat wanneer ons praat oor van hierdie goed, dan sien ons kan nie die Bybel gebruik om hierdie te interpreteer. Ons kan nee sê vir mediese redes. So ek dink, daar is sekere mediese goed, ons kan voel, maar die goed is nog nie getoets nie en 'n klomp goed. Maar soos wat ek nou gesê het, dis belangrik, dat 100 jaar terug, het ons die pokke-pandemie gehad. Die mediese het 'n klomp goed, moes kom toets en aanspreek, en kom goed uitsorteer. So, ek dink is so belangrik, dat ons die regte fokus sal hê, en dat ons nie die Bybel sal gebruik, om sekere goed te regverdig nie, maar dat ons eerder 'n pad met die Here sal stap, en sê, Here, wat is dit wat U van my verwag, in die midde van hierdie uitdaging? So om jou laaste vraagie dan te antwoord, Phillip, dink ek die belangrike ding wanneer ons oor van hierdie goed gesels, is wat is die raad wat ek mense moet gee? Ek dink dis die raad. Ek dink ons het nodig om vir mekaar te sê, skrif gaan oor Jesus en Jesus gaan oor jou. Leef in verhouding met hom. Vra die vraagie, is hierdie 'n absolute interpretasie of aanname? Besluit waar dit lê en maak seker dat jy dan fokus op dit wat jy voel, die Heilige Gees of die Here jou in begelei. Maar moet asseblief nie jou ervaring en jou opinie almal se opinie maak nie. Want ek dink ons het verskillende opinies en verskillende perspektiewe. En ons het nodig om te vra wat se prolette kom.
Absoluut. Martinus, en dan dink ek is dit reg om die volgende vraag of die volgende stelling al amper te maak. Ek sê dit baie soos wat ek met die mense praat. Hier is eintlik nou twee verskillende gesprekke wat besig is om aan te gaan in die wêreld. Die een is 'n wetenskap gesprek wat gevoer word rondom die vaksin, die wetenskap agter die vaksin wat ons dan nou later gaan bespreek, en dan is daar 'n geestelike gesprek. En dit is so gevaarlik om hierdie twee te meng. Want wetenskap en die Bybel het twee verskillende eindresultate, as ek dit so kan sê. Sal jy saam met my stem daarmee? Wat se opmerking het jy om te maak?
Ja, ek dink dit is so belangrik dat ons sal verstaan dat die Here ons geroep het om koninkryk te vestig.
Yes.
So ek sê altyd, ons werk is koninkryk. So ons het nodig om die Here te vertrou vir bonatuurlike wonderwerke om te gebeur in mense se lewens. Dis ons werk. Ons het nodig om te sê, okay Here, hoe navigate ons? Waar het ons nodig om kos te gee? Waar het ons nodig om te help? Waar het ons nodig om die goed aan te spreek? Kom ons wees Christus vir die mense om ons. Ek word so herinner aan Paulus lewe, die gemeente in Korinthe vra hom, hulle sê, wys vir ons Jesus. Jy praat oor Jesus, wys vir ons Jesus. Hy sê, kyk na my lewe. So my vraag is altyd, as mense na my lewe kyk, wat sien hulle? Verstaan, dis vir my so belangrik, want ons het vriende in Durban, waar ons gevoel het die Here praat met om te belê in hulle lewens. Toe bel hy my, toe sê hy, Martinus, jy sal nie verstaan, wat beteken dit wat jy gedoen het? Ons het 'n trok afgestuur van Bloemfontein af Soontoe. Mense het van oral af gekoop om kos te bring, mense kos te gee, want die grootste behoefte op die oomblik in Durban is juist daai ding van mense het kos nodig. Hulle het nie kos om te eet nie. Hulle het nie werk nie. So hoe help ons hulle om seker te maak ons is lewendige koninkryk in elke situasie en elke omstandigheid. So ek dink dit is so belangrik dat ons daai goed nie van uit 'n mediese perspektief uit, kan ek jou nie antwoord nie. Uit 'n geestelike perspektief uit dink ek dit is gevaarlik om aannames te maak en interpretasies te maak en sê hierdie is dit of dit of dit. Want ek dink ons verantwoordelikheid uit 'n geestelike perspektief is, die opdrag is, ouens, leef in verhouding met my en bring my oral waar jy gaan. Dis die opdrag.
Ja.
Dis interessant, mense vra baie keer vir my, wanneer ons kom oor die boek van Openbaring en 'n klomp interpretasies rondom, dan sê, weet jy wat was die agtergrond van die boek van Openbaring? Hier is Johannes, hy is die enigste disipel van Jesus, wat nie gesterf het vir sy geloof nie. Hulle het hom met olie gegooi, aan die brand gesteek en hom gelos vir dood. Maar hy het nog daai werk gehad vir die Openbaring, om daai Openbaring te gaan skryf op pad van Patmos. En hy het daai brief geskryf terwyl die Romeinse ryk die ouens verdruk het. Op 'n Sondag het hulle keiser se beeld opgerig in die plein oral waar hulle gegaan het. En elke mens was gedwing om voor die beeld te buig. As jy nie het nie, dan het hulle jou in wat hulle genoem het die poel van vuur gegooi. Nou skryf Johannes daai brief en hy inspireer die ouens uit die boek van Openbaring. Hy inspireer hulle om te sê, weet jy wat, of verloor jy alles vandag? Sien Jesus Christus as die een met die 4 oë. Sien Jesus Christus as die een met die wit kleed. Sien Jesus met al hierdie verskillende goed. En eintlik bring hy 'n klomp verskillende perspektiewe rondom dit, want hy het die brief geskryf nie net as 'n profetiese uitspraak nie, maar as 'n inspirasie vir iemand wat môre sou sterf.
So, fantasties, hoorie. Dankie dat jy vir ons 'n goeie fondasie gelê het op hierdie goeters. Ek dink as ons na hierdie video kyk, die mense, wil ek jou uitnooi, fokus op die fondasie, fokus op die raamwerk wat Martinus vandag hierso neergelê het, eerder as om aannames te maak op aannames van sekere goeters wat versprei. Ek dink Martinus het vir ons 'n brokkie waarheid gegee. Ekskuus tog, en iets om oor te dink vandag. En ek wil jou net weer uitnooi, soek altyd God eerste, en soos wat hy gesê het, ons moet ons identiteit in Christus verstaan, want wanneer ons vanaf hemelse plekke saam met Christus uitsprake maak, dan is ons uitsprake reg en lewendgewend, en dis wat ons nodig het op hierdie stadium, ons het eerder lewe nodig as doodspreek in hierdie tyd. So Martinus, baie dankie. Dankie vir jou tyd wat jy uitgekoop het. Dit is altyd lekker om met jou te gesels. En ek weet nie of daar 'n laaste opmerking is wat jy wil maak nie. Maar ja.
Ja, ag Phillip, baie dankie vir die geleentheid. Ek wil regtig ouens aanmoedig dat elke ou het 'n opinie en elke ou is geregtig op sy opinie. My hart en my begeerte is, mag ons regtig iets van Jesus openbaar. Oral waar ons gaan en alles wat ons sê, mag dit die fokus wees, want ons is deel van goeie nuus.
Dankie. Martinus, baie dankie. Ons gaan nou vir jou groet en dan gaan ons binnekort met Dr. Pauline praat wat bietjie die wetenskapkant nou gaan verduidelik. Ek en Martinus is kenners in die woord, of ons maak onsself uit as, en ons kan nie die wetenskapvrae beantwoord nie, maar ons gaan nou met haar praat. Maar Martinus, ek waardeer jou tyd. Dankie dat jy dit uitgekoop het vir ons, en mag dit wat jy mee besig is, hoe sê ek vir die mense, mag jy gebuig loop onder die seëninge van die Here, en mag net goedheid en guns jou volg. Maar baie dankie vir jou tyd.
Dankie Phillip, waardeer.
Okay, julle, so hier het ons dit nou. Ons het nou lekker na Martinus geluister en hy het vir ons 'n unieke manier verduidelik hoe om die Bybel te gebruik om die moeilike vrae te beantwoord en die kwessies wat ons vandag in ons wêreld, kan ek maar sê, face, Covid en alles, het hy vir ons lekker antwoorde gegee. Nou is dit vanaand is dit vir my 'n groot eer om vir Dr. Pauline Howell aan die woord te stel. Sy gaan bietjie meer die wetenskap gesprek nou vanaand met ons voer. Ek wil net so vinnig sê, sy is die Senior Medical Officer and Investigator at the Clinical HIV Research Unit at the University at Witwatersrand. So wanneer sy praat, weet sy waarvan sy praat. Sy doen ook baie navorsing in HIV, met COVID en dan ook met tuberkulose werk sy ook. So sy gaan vanaand 'n bietjie van die vrae wat julle vir ons gevra het beantwoord, of sy gaan haar bes probeer om die vrae te beantwoord. En ek wil ook maar net noem, sy is getroud, sy het 3 kinders en sy het 'n pragtige man, ek kan dit seker maar sê, sy is doodgelukkig en sy het groot geword in die Vrye Gereformeerde Kerk in Johannesburg. Nou dis 'n mond vol, want sy is Engels, maar sy het in 'n Afrikaanse kerk groot geword, maar huidigelik is sy ook deel van die Union Church in Mildersdrift. So baie welkom en dit is vir my so lekker om altyd met 'n dokter te praat wat ook 'n Christen is. So wanneer ons hierdie vrae beantwoord, is dit nie net 'n wetenskaplike wat met julle praat vanaand wat geen liefde vir God en geen liefde vir mense het nie, maar dit is iemand wat ook 'n liefde vir God het en 'n soeke daarna het vir die waarheid. So Pauline, baie welkom. Weet nie of jy ietsie wil sê voordat jy wegtrek en die vrae beantwoord wat op almal se harte is nie.
Baie dankie, Philip. So, like Philip said, I understand Afrikaans perfectly, but my accent is a little heavy, so I will try and read the questions in Afrikaans, and I'm sure it's fine for you to have a good chuckle, but I will be answering them in English because that's how I am the most comfortable, also from a scientific perspective. I do have a bad habit of speaking too quickly, so if I do speak too quickly, please feel free to rewind and listen to that part again. But yeah, can I start screen sharing then, Philip? Is that cool? Okay, there we go. Can you see that? Perfect. Okay, so COVID-19 updates and frequently asked questions. So I'll be starting by just giving an overview of where we are and where we've come from, and then I'll delve into your questions. And at the end, after the questions, then Philip and I can have a discussion about any outstanding questions that there still are. So what is COVID-19? As you well know, on the 31st of December in 2019, the World Health Organization reported a cluster of pneumonia cases in Wuhan City in China. They called it Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2, which is the name of the virus, and it was confirmed as the causative agent of what we now know as COVID-19. Since then, the virus has spread to more than 220 countries and territories, including South Africa, as we well know. Looking at the Worldometer's info for coronavirus, which I accessed today, you can see here, I'm not sure if you can see my pointer, but there are over 200 million cases confirmed of COVID worldwide today, with a total of 4.2 million deaths. So COVID is a real thing. In terms of the sort of ranking in South Africa, here we are at number 17 in terms of total cases, and this is total cases reported. This is always an underreporting because people who are asymptomatic don't go for tests. And South Africa is sitting at just shy of 2.5 million. Let's go back a little bit about this coronavirus. And it's interesting to note, and this is something that people are not always aware of, but on the 31st of January, which is just a month after that we knew that it existed, the Louis Pasteur Institute had already sequenced the full coronavirus. That means that they did a full genetic sequencing of the virus, and they know every single little piece of protein and the DNA and RNA, or rather the RNA that makes up that coronavirus. And unlike other viruses, What they did with this is that they made it completely open source. So they put it up on the internet, and any research places or any labs around the world could use the sequencing information of this virus to start working on a cure and on vaccines. Then you'll see here that this is from the 23rd of April 2019 from Nature. Nature is an incredibly well-respected scientific source for information. And here they are saying that already 1 million coronavirus sequences had been done. So in about 15 months, 1 million different sequences had been done. And this is how we know about the different variants, like the alpha variant and the beta variant, is they sequence this virus. This all sounds quite technical, but I'm getting to a point. And here you can see that this really has been an extraordinary collaboration. In this middle one, you'll see that this gives you an idea of how many times people have figured out the exact genetic genetic sequence of this virus. So what can we learn from this? It is a virus. If you've read that it's a bacteria or some other thing, it's not. It's a real virus, and we know what it's made up of. 2, the world has really come together in sharing this knowledge. In pretty much any other disease, it is highly guarded information because there's often a race for vaccines. And so having the latest sequencing data is something that a lot of the big pharmaceutical companies can keep to themselves, although especially for flu that has changed. So why is it called SARS-CoV-2? Well, because we've already had a SARS. So here, SARS on the left, you will see SARS, which is severe acute respiratory syndrome, which is the same as SARS-CoV-2. And in 2003, it was seen as a deadly virus. 774 deaths were reported between November 2002 and July 2003. And this led to a worldwide panic, although not in the same way as COVID. Interestingly, for SARS, it killed a lot more people a lot more quickly, which means that it wasn't transmitted as quickly. MERS on the right-hand side is another variant, and it's like a sister. And this is very much associated with camels, but also very infectious, but a much higher death rate. And so in the Middle East, until about June this year, because it still is actually transmitting, there were about 886 deaths. We've been able to contain these much, much better. And these 2 diseases actually led to the first, to the mRNA virus technology. The vaccine technology. So here you can see an article from the BMC, a Journal of Medical Science, talking about how the coronavirus vaccine development was actually started with SARS and MERS. But because it was never as much of a threat worldwide, the mRNA platform of technology didn't get that much further. But this technology has been around for at least 20 years. So here you see where we are today. 29% of the world population has received at least 1 dose of COVID vaccine. 15% is fully vaccinated, and 4.32 billion doses have been administered globally, with 42 million now administered a day. But only 1.1% of people in low-income countries have received at least 1 dose. And really, this has been an exercise in showing us that there is a really, really significant issue with access, and it's an absolute tragedy, especially if I look at colleagues in India who a couple of months ago had people dying on the hospital floors clutching empty oxygen cylinders because there just wasn't the infrastructure, there weren't the access to vaccines or the medical care that they need. And you'll see on the bottom is the reference. The interesting thing to note here is because 4 billion doses have already been administered, that makes COVID the 2nd most well-researched vaccine in the world, just because of the sheer absolute numbers. And that's something interesting to keep in mind. Here you see the map. It gives you an idea by color at how well vaccinated certain areas are. And you can see that the entire continent of Africa is lagging behind significantly. This gives you a different kind of snapshot, and it shows you in absolute numbers how many people have received doses. So you'll see that mainland China leads the world and that mainland China has already given 1.73 billion doses. So the idea that it's a Chinese conspiracy theory to try and kill off the rest of the world is probably quite far-fetched, as they've had to invest more in their own vaccines than pretty much anywhere else. Just to note that the time that any African country features on this list is South Africa, and you have to scroll down about 1.5 minutes almost. It's yeah, in terms of absolute numbers, I'm happy to say that South Africa did hit 8 million yesterday in terms of doses given. So this website, World in Data, is really nice because you can add and take away countries to be able to do comparisons, to be able to track where we are. So this gives you an idea of, on the left, the percentage for the population, and on the right in terms of absolute numbers. So you can see that we are lagging behind quite a bit. The darker number are people that are fully vaccinated, which would either be 2 doses of Pfizer or 1 dose of J&J, and the light green is people who have received only 1 dose of Pfizer. Okay, so that gives you an idea of where we've come from. So we'll start moving into some of the questions. Vraag 1. Is die vaksin veilig? Werk dit? Wat is die verskil tussen die klomp wat daar al op die mark is? Okay, that's a lot of questions and it's a lot of content. So we'll take some time to go through this. Okay, first of all, we just need to recognize that vaccines have come a very, very long way. There are some of us who still remember the time of polio. I know my mom's neighbor got polio, and if you look at a lot of things that are doing the rounds on the internet at the moment, is that lockdowns and mandated mask wearing is not new. If you look at pictures from the early 1900s, when there was polio, when there was smallpox, it was completely normal for people to have to stay at home for weeks and weeks on end. And some of the older generations will still have the smallpox marks on their arms, but the younger people are forgetting that there was a time where these diseases killed. And now you've got people who think that it's a great idea to have pox parties, or rather measles parties, or for chickenpox. And there are still children dying from chickenpox who are getting meningitis, and people dying of measles. And I've treated those myself, and it's a tragedy. So just to compare how far we've come with vaccines, in 1980, you had protection from 7 diseases, but the technology at the time, we were giving an average of 15,000 antigens to develop that kind of protective response. And whereas in 2017, we now have protection from 16 diseases with just 173 antigens. Our technology has gotten a lot better, our concentration ability has gotten a lot better, and the refinement and purification and cleanliness of overall vaccines is significantly better than it's ever been. So this idea that we are giving these poor children, tons and tons of shots that they never were exposed to is frankly rubbish. Okay, so just to give you an impression, people are very worried about the side effects of the COVID vaccine, but don't spend that much time thinking about the side effects of COVID. And so this first little table on the left is quite an interesting one, and it shows that you've got the chance, and this is then chance in a million, of serious harm due to vaccine side effects in a 25-year-old would be about 11 in a million, and in a 55-year-old would be about 4 in a million. That sounds a lot, and it sounds quite scary. So let's think about your chance in a million of dying with coronavirus. If you're 25, is 23, but if you're 55, it's about 800 in a million. Your chance in a million of dying due to an accident or injury is about 110 in a million if you're a 25-year-old, but 180 in a million if you're 55. Dying in a car accident, and these are international stats in South Africa, this one is significantly higher, 38 in a million if you're 25, and 23 if you're 55. And your chance of being hit by lightning this year, not ever in your life, this year, 1 in a million. Okay, so that is what 1 in a million means. I don't know anyone that's been hit by lightning. I don't think I know anyone who knows anyone else that's been hit by lightning. It's not even one handshake away. So let's talk about the common side effects of COVID. And I know that no doubt there will be people who have had COVID, have loved ones who have had COVID, and have loved ones who have passed away from COVID. I definitely have, including young people and friends. So fatigue, even some people, so fatigue is incredibly common. Shortness of breath, joint pain, chest pain, cough, loss of smell, runny nose, red eyes, loss of taste, headaches, sputum, lack of appetite, sore throat, the fuzziness in the head, vertigo, muscle pain, diarrhea. And these are just the common ones. And this is very much in long COVID. And there are people who have had long COVID for months and months and haven't been able to return to work. So it's not enough to say, oh yeah, I survived. There are also long-term effects. There are people who have irreversible lung and heart damage and are unable to have children, for example, or get told that they would not be able to carry a pregnancy. And they're, for example, in their 20s or 30s. People that will never be able to do sports again because of the damage. So like I said, it's not just survival, it's also long-term health effects that you could get stuck with. There's also emerging literature that shows that people who have COVID have a significantly increased incidence of being diagnosed with new conditions. There are people being diagnosed with diabetes that have never had diabetes before, and the huge immune issue with COVID has actually now brought this diagnosis out and into the open. And they are very likely to not have had this if they didn't have COVID. So COVID is not harmless. COVID is not the flu. COVID kills people. So going back to what is 1 in a million. So you wanted to know what are the side effects of the vaccines. They do exist. And here it is in one slide. But let me just say that the discussion among ethicists and Christians alike is it responsible to tell people about these side effects that are so incredibly rare, but scare people? And the problem is that if you scare people, even if something is very, very rare, they are less likely to take the vaccine, which makes sense. You want people to be informed. But what the ethicists cannot agree on is if the risk of people not taking the vaccine outweighs their right to know these numbers. And because there are so many conspiracy theories out there and people are so distrustful of the science, the almost unanimous decision is to make everything available. And it is. Everything is available. Everything is searchable. And I've been involved in the Janssen vaccine trials. And my patients were all okay, but these trials are absolutely massive with tens of thousands of people. So the first one in the Johnson vaccine, thrombosis with thrombocytopenia syndrome, happens in 3 cases per million among adults. Okay, those are incredibly tiny numbers. Guillain-Barré syndrome, which is a paralysis that moves up your body, that you may or may not need to be admitted for, happens in about 7.8 cases per million doses among adults. So in terms of the thrombosis one, everyone goes, oh, I've had a clot, I must definitely not get Johnson & Johnson. But if you speak to one of the top doctors who is involved in treating people with weird clotting conditions in the country, and he's taken it upon himself that if everyone in South Africa gets this vaccine, he'll have maybe 20 of these cases. He will treat every single one of them at Mill Park in Johannesburg, and they will foot the costs. He will tell you that if you've had clotting issues, you better get the first vaccine you can get, because your chances of getting a clotting issue if you get COVID is 25 times higher, and then it will probably take you out. So the vaccine stuff we can monitor. If you've got a medical condition that makes you unsure about whether or not you need to take a vaccine, talk to your doctor first. That's always the first line of inquiry. Please do not make a decision based on these tiny, tiny numbers that you'd be better off without a vaccine. Because unfortunately, so many people have had such severe COVID or have given it to someone who ended up having incredibly severe COVID. And unfortunately, that is on the person that transmitted that disease. And that is a huge responsibility that people take. In terms of the mRNA vaccines, moving on to the block on the right, the risk there is a myocarditis, and that's usually in younger men. We're looking at late teens, early 20s, and this is completely reversible. It's just inflammation around the heart. And again, very rare, 2.5 cases per million, and something that they're aware of. And there's whenever you go and get your vaccine, for those who've had your vaccines, you will know, you get a little information card with, if you get this, this, or this, please contact this number. And so that's the responsible thing to do. Does the vaccine work? And this is where it gets really cool. So if you look at this really nice representation from the United Kingdom, they looked at cases versus deaths in the second wave versus the third wave in the UK. And the difference between the second and third wave is that they had significant uptake of immunization, of vaccination between the two waves. And so on the, can you see my pointer, Phillip, here? You can, great. Okay, so in the second wave, on this first bit here, you can see the cases per 100,000 population. And you can see how in the weeks, those cases went up. And then this is the deaths per population. And you can see how the deaths follow on with the cases. In the third wave, after vaccination and high uptake, the cases you can see are pretty much the same, which is not unusual, and I'll explain later why. But look at the difference in the deaths. And that really is the power of the vaccine. It stops you from getting really sick and needing admission, and it stops you from dying. And that's really the important thing. There is also an effect that it stops transmission or it decreases it significantly. And if you have been vaccinated and you get COVID, there's good evidence to show that you are less infectious. But that data is based on different strains, and with Delta, that might be less true. And the data on that is still growing. So let's look at this in a little bit more detail because it's so interesting. The caveats, so just so you know where we're coming from, the UK is highly vaccinated compared to many other countries, 85% of adults with at least one dose and 63% of adults with 2 doses. What is the level at which we consider a country to have herd immunity? About 80% of all people. That's not just adults, that's all people, including kids. And in South Africa, for example, a third of our population is actually under 18. So our time to herd immunity, we are a very, very long time away. There's also been a very high vaccine uptake at the most vulnerable older ages, where we've still got a very large population of older people that are very hesitant at the moment. But high case numbers are still like playing with fire. Each infection has the potential for long COVID, as well as giving the virus more lottery chances to create new mutations or variants. So every time COVID passes from one person to another person, it has the opportunity to mutate and become a new variant, which has its own implications. The link has been weakened by this high uptake of vaccines, but not broken, because they haven't yet reached herd immunity. Hospitalizations are still trending up, as are the deaths. And the bottom line here really is that despite quickly rising cases, let me just move this, sorry. The vaccine wall is holding up in the UK, protecting people from severe disease and death. And that is something that we can be very grateful for, that the Lord has given us the technology and the experience and the work and the effort and the ability to move forward in medicine in this way. Okay, so here we can see the cases in a more graph representation. So this is the second wave, and here's the third wave, and we can see the cases trending up in the UK, and this was done at 45 days. You can see hospitalizations significantly reduced and deaths even more so. And if this basically is the slide that will show you how well vaccines work, which is really exciting. In terms of how well it works in South Africa, well, they work. We do know that they work. This is Sonke study, which is the study under which it was really an access program, and that was the way that most doctors and nurses and other healthcare workers received the Johnson & Johnson vaccine, showed that it was effective and it reduced your risk of severe disease, hospitalization, and death. So in those healthcare workers that did get reinfected with COVID, 92% had mild disease, 4% had moderate disease, I think it was 7% had moderate disease. Sorry, I'm doing it off the top of my head, but the short story is that it was only 2% that ended up having a more severe disease, which was great protection because the healthcare workers really are at the front line and are getting the most exposed out of anyone. And just to say that this is not just doctors and nurses that got immunized, but it was also people that work as cleaners in the hospitals, people that worked in the mortuary, you name it, they got it, including clerks, etc. So we've also got evidence from South Africa that the J&J vaccine is effective against the Delta variant, which is really great news. Because we know that genetics vary between different populations in the world. So it's good to know that it also works in South Africa. It's not just first world information. Recent data from Harvard show that the immune responses are long, lasting even up to 8 months. And the only reason why we don't know if it lasts longer is because we just haven't collected the data yet. But what's interesting to note here is that we demonstrated that a boost is not needed at this stage. So if you've had your first shot of J&J, you do not need to go and see if you can try and sneakily get yourself a Pfizer. There are trials being done for that, but at the moment it's not necessary. And data on the first dose, on the 2-dose J&J study, ensemble 2, and the durability of the single-dose J&J will become available this month. So the information is becoming available rapidly, and it's informing our guidelines and changing how we do things. What's really been great is that it's actually showed that the immune protection increases with time, very much unlike your natural antibodies if you got infected. So with the Pfizer vaccine, data throughout the world shows that the Pfizer vaccine is still effective against the Delta variant, and the local data emerging South Africa confirms that the Pfizer is effective. Preliminary data will be available in August from evaluations through the medical aids. Excuse me, let me just take a sip. So what about long-term side effects? I've had a lot of family members ask me about this, especially my family members that are a bit younger, and they say, what if it makes me infertile? What if they don't have the data yet? How can we know? And really, we do know. We've got a very, very robust history of work in vaccines. And really, we know that historically, if you're going to have a side effect to a vaccine, you will have it in the first 6 weeks. And we've got more than enough data to show the safety in the first 6 weeks. Millions, well, billions now have received the COVID vaccines, and no long-term side effects have been detected. Globally, we do continue to monitor the safety of COVID-19 vaccines, and I promise you there is no way that any of these results get hidden, because every researcher and investigator gets the full report of every serious side effect that happens around the world. I must get 20 different reports that are updates of this one. So this one guy that got a clot, you get an update every 3 days about how this guy is doing, which is great, but it's a lot of information. And the thing is that nothing gets hidden. It is regulated, and it is incredibly important that this gets done properly. And it's not just internationally. Within South Africa, we've got the South African Health Products Regulatory Authority, which also had to approve every single one of the COVID vaccines again for South African use. Then we've got the Departments of Health. We've got international guidelines like GCP. We've got ethics committees, which are not just scientists that sit in those ethics committees, but it is lawyers, it is community advisors. Sometimes we've got pastors, and sometimes we've got traditional healers. You've got all sorts, and they weigh in on the ethics of every single study. Not a single study gets done in South Africa without going through all of these peer review measures and ethics review measures, and then scientific SAPRA measures and Department of Health that again weighs it too. Getting a study approved usually takes a really long time. But what is great is that they've decided to lift some of the red tape, and they have been fast tracking all COVID vaccines in terms of regulatory approvals, which is good. I know some of the people that sit on these ethics committees, and they were having calls until 10, 11 at night. So everyone's doing what they can to try and move this forward, because they know that time is lives, especially during this COVID pandemic. Okay, so overall, the important take-home message here is that vaccines in the national rollout are safe and effective, and the risk-benefit ratio favors vaccines. That's the very medical summary of that one. And just to mention, here's a picture actually of someone I know who posted on Twitter. And she said, "My reign of COVID patients today, only one is vaxxed and on high flow oxygen and texting. The rest are unvaxxed, intubated, so they've got a tube down their throats to keep them breathing, lying on their bellies, so proning to try and get more air to the back of their lungs, on dialysis, so some of them went into renal failure, sedated and paralyzed to be able to keep that tube down. She says, I'm sweating in a plastic PPE, like I took a shower in scrubs and having new face wounds from constantly wearing the mask. Look at the age here. These are not your 60s and 70s only. This is all the way from your 20s, all the way to your elderly, and they're all in ICU. Especially the Delta variant has been hitting all the younger ages too. And please don't think that you are immune to this. And if you do get off lightly, there is no guarantee that you're not spreading it to someone who won't get it badly. Okay, in terms of are there different kinds of vaccines? Yes, there are. There are differences between the J&J and the Pfizer. So I'll try and keep it a little bit easier to understand. So the mRNA vaccine, which is Pfizer and Moderna, is a molecule that tells our bodies to make proteins. The mRNA from the COVID virus tells our cells to make harmless proteins just like those on the virus. The Pfizer and Moderna vaccines go this way, and I'll go into that a little bit more because it feeds into one of the other questions. The protein subunit vaccines, which is much more like our traditional vaccine, where you give a little bit of protein that looks like a little bit of the outside of the virus, but doesn't have any active replicating things in it. And it contains harmless pieces of proteins unique to the COVID-19 virus. And the vector vaccines, like AstraZeneca, use another virus that has been made safe. J&J also works like this. Material from the COVID-19 virus has been inserted inside of it, and usually it's some of the spikes, so it's like hair on the outside of the vaccine, of the COVID part of the COVID virus, The material tells our cells to make harmless proteins unique to the COVID-19 virus. So at the end of the day, they all make the body see something that reminds it of COVID. None of them have got anything actively replicating inside them. You cannot get COVID from any vaccines because there's no live COVID vaccines anywhere on the market or anywhere else, and there never will be. They all work by stimulating the body to put on its boxing gloves and figure out what to do with this protein. The difference between getting a vaccine is it gives the body time to get used to this and make a small army in case it ever sees it again. So they don't have to have a long conference about whether or not this is or is not harmful. If you get COVID though, you get the entire bug and it replicates. And before the body has decided to fight it, it's fighting you. The COVID vaccines don't fight first. And that makes the big difference. I was asked to look at comparing them, and there is so much data out there. I know that this is very small. I don't expect you to be able to see all of it, but people are comparing the efficacy of the vaccines all the time. It looks at the variants, the efficacy of the variants. It looks at the overall efficacy, and that efficacy is all based on whichever variant was circulating at the time. I'm sure you'll remember a couple of months ago, they were saying, oh, J&J is really not great, but that's because we were using it as the new beta variant, or as the new South African variant was coming out, the beta one. Whereas the Pfizer Modernas, who had been tested in very much a lot of the first world countries earlier, was showing to have much better efficacy because that was still the original variant, and all the vaccines are better against it. So it's very difficult to compare apples with apples when it comes to that. Now with Delta coming out, we know that it works well, but the important thing to note here, which is true for all vaccines around the world, is that there is no such thing as 100% effective. There is no such thing as 100% no side effects. That doesn't exist. It doesn't exist with medicines. It doesn't exist with vaccines. Panado will kill you if you have too many. Grandpa will kill you if you've got too many. Vaccines do not work 100% of the time, but they are pretty close. Really, the data has shown us that they are the second most efficacious vaccine, and they are almost one of the most well-studied vaccines that we've got. And although some people say, oh, I'd rather have this one because I'm scared of this side effects, the best vaccine is the one that you can get today. Okay, so if you want a little bit of a more user-friendly approach to comparing the vaccines, if you're interested, there's a nice link here for further reading if you'd like. Okay, question 2, vraag 2. Hoe is dit moontlik dat daar so vinnige inenting is? Ek dink meeste mense se kop slaan vas op hierdie ene. No jokes. I think that's a lot of people have problems understanding this. So I hope you understood that in the beginning when I explained to you that the full genetic sequence of the virus was made available, and it was made available open source a month after we found out that COVID existed. That made it possible for all of the vaccine manufacturers in the world to get their heads down and to get working. The mRNA the mRNA vaccine, which everyone is thinks is very controversial, has actually been around for 20 years already. They just took the old technology and the new genetic sequence, which was freely available online, and started working. They didn't first need to do 20 years of R&D. And so really, where have the shortcuts been taken? Because people don't understand how the difference could possibly be there. And it's really been in the, well, let's see. So in terms of priority and collaboration, scientists, doctors, ethics approval boards, which I've discussed, manufacturers and regulatory agencies have all come together to work harder and faster. I've got many colleagues who were working 14 to 16-hour days, and they just, it's been hard. In terms of science, advances in vaccine technology that are built on the back of many years of research. So I've explained the mRNA vaccines, they've been around for 20 years already. The J&J vaccine uses the exact same technology that it used for the Ebola virus vaccine, for example. So that vaccine is also existing. Volunteers. So these trials have enrolled more quickly than any other trials ever before. I am used to working in drug-resistant TB, where if we get, 4 or 5 drug-resistant TB patients a month, we're having a really good month. And for the J&J vaccine, we were working until 9:30 at night, and we were enrolling 100 patients a day. So people have really come forward to want to take part because they saw that as their way to access the vaccine earlier, even though half of them were getting placebo. So these are well done trials. The science hasn't been short. There's no shortcuts on the science. The shortcuts is in, I shouldn't say shortcuts, but you know what I mean. It's really been in lifting red tape, in fast tracking, in getting through bureaucracies, in trying to get departments of health like ours, for example, to work longer and harder and to push things through that would usually take a year. In terms of manufacturing, large-scale manufacturing of the vaccines occurred in parallel with the clinical trials to scale up production quickly. So you didn't have to wait for every single one thing to happen. They worked with they basically work to try and logistically speed up the process. And there's no problem with it from a scientific perspective. And funding. COVID has had an enormous financial impact around the world. And at the end of the day, if all of our economies pack up, then we're all in a bad place. And so there's been funding internationally to get this done. And that is really, these are the main reasons how it's possible for these vaccines to have been developed more quickly than usual. Even from the departments of health, they realize that this is something people are worried about. And so they say because of the risk from COVID-19 and its prevalence, it was possible to expedite the clinical trials without compromising safety. Thousands of people signed up rapidly to participate in COVID-19 vaccine trials in 2020, compared to the 12 to 18 months it often takes to recruit far fewer participants for such trials. These vaccines have been tested with more participants than many earlier vaccines for other diseases. And so just to give you a compare, the traditional vaccine development on the top compared to accelerated vaccine development on the bottom. And so 1 to 5 years for the discovery. This was pre-existing for COVID, no problems there. The preclinical, that means in animals, usually takes 2 to 4 years. But because we already knew what SARS is, SARS-CoV-2, it's so similar to SARS, that could be accelerated. Phase 1 is usually your first time safety in adults, and these are healthy adults, and you basically give it to people and see what happens. If you want to call anyone a guinea pig, it would be phase 1 participants, and those were done usually in the countries of the pharmaceutical companies and were not done in South Africa. The phase 2, on the other hand, was done in South Africa, and this is a dose-finding study. So you're giving, it works, or you've got a very good reason, or you've got a very good idea that it works, but you then give it in different doses and see what can be done. And that's how we figured out what the correct doses are for these vaccines, and that we could see that the J&J had a very durable response, which is why it was possible for J&J to only have one vaccine, whereas the others require boosters. And J&J may well need a booster in the future. That's why there's a vaccine trial ongoing with 2 doses. And then phase 3 is usually the very large trials with about 40 to 60,000 people, and those enrolled incredibly quickly. Unusually quickly. We were all very stressed out about doing this. And then the reviews, which are done by the FDA and the EMEA, were also accelerated significantly. But just to say that I've been working in the research environment for more than 8 years now, and I know how research works, and I trust that this is scientifically sound. Okay, vraag 3. Ek het nou COVID gehad. Is dit nodig vir my om die inenting te kry? Is natural immunity nie genoeg vir my nie? Op dieselfde vraag, my man is positief getoets, ek negatief. Hoe weet ek dan of ek kan gaan vir die inenting? Okay, so we'll deal with the second question first. No test is 100%, unfortunately, but that's the truth of it. If someone tests positive and the other person tests negative, the first thing you need to ask is what kind of test was it? There are a lot of tests out there, and some of them are not as good as others. If you like to go to Clicks and pay your 200 Rand for your antibody test, the sensitivity on that is quite atrocious. If you have very mild COVID, you will have almost no antibodies, and even though you've got COVID, it will test negative. Please do not use the antigen tests. The antibody tests, they are no good. The antigen tests, though, that is a different thing. Those are pretty good, but they're more difficult to find, and the government is going to start rolling them out soon. But the usual PCR test, where they swab the back of your throat and it feels like they're trying to do a brain biopsy, that's pretty good sensitivity, but it's not going to get everyone. So it's entirely possible that you do have COVID, even if your test was negative. And so if you have any symptoms, or even if you've been in contact with someone positive, please keep to the NICD guidelines to protect those around you. In terms of the first question, let's move on. Okay, so this is a nice infographic, and it shows you the difference between immunity to COVID-19 if you've got natural infection with SARS, so you got COVID, versus vaccination. Excuse me. Okay, so if you got COVID, you may well become very unwell or die. You have the potential to develop long-term complications, and you can spread the virus to others. If you are vaccinated, you have significantly reduced chance of developing COVID-19 and how unwell you become. It induces an immune response, but in a safe and controlled way, and it reduces the chance of spreading virus to others, and the vaccine cannot give you COVID. In terms of your actual immune response, this varies hugely between people. Many factors impact on your immune response effectiveness. For example, age, any other underlying conditions such as diabetes, autoimmune conditions, if you're a cancer patient. Some people do not have a detectable long-term immune response. In fact, a lot of people who had mild COVID have almost no antibodies and have therefore probably very little protection going forward. And whatever little protection they do have, we have no idea how long it lasts. It may also be linked with disease severity. So we believe that the people who were very, very sick are likely to be protected for longer. This is the reason why people who've had COVID and were admitted to hospital are now being told to please wait for 90 days before getting their vaccine, because then that vaccine can be a booster, because there's a good chance that they'll be protected for at least 3 months. But that only applies to people who needed to be hospitalized for their COVID, which is not a pleasant experience and not really worth it. In terms of your vaccination, your immune response varies, but most, even older people, produce a strong immune response. It may produce a more robust immune response than natural infection, and immunity to the virus from the natural infection is boosted after vaccination. So if you've had COVID, please go and get a vaccine to boost yourself and to have durable long-term protection. In terms of your length of protection, If you've had COVID, it's variable and, like I said, not fully known, and it reduces over time, and protection tends to be lower in people who were mildly ill. If you have the vaccine, though, it's still to be learned, but 2 doses, so these 3, produce a long-term protection. And this is from the UK, where they haven't used the J&J as much, but so far the J&J looks to be as robust as the other 3. And the booster vaccines could maintain a strong immune response. In terms of variants, reinfection is possible but uncommon. But just to note that in the South African context, we have had a significant number of people who were infected in the first wave that have become reinfected in the second or third wave with the variants. So having any variant is unlikely to protect you against other variants. As response to the natural infection is variable, the immune system may not be able to recognize the variants for that reason. Whereas the vaccines give strong protection against many of the identified variants that we have at the moment, although this might change. And we might end up in the future in a situation where we need to have a yearly jab like we do for the flu. But that's still a far sight better than the 200 million infections and deaths that we've seen. The high antibody levels are produced are more likely to cross-protect against the new variants, but vaccines can also be adapted. There have been, like I said, more than 1 million of these COVIDs sequenced, and so it's not going to be too difficult to also make these boosters when we figure out that they work. Just to note here that a lot of people say that they don't want to get vaccines because they don't want to be guinea pigs on clinical trials. But really, with the sheer number of people that are being vaccinated at the moment, if you choose to not be vaccinated, all you are doing is you are part of the control group. So vaccination is safer than relying on natural immunity when you get COVID, because there's a risk of serious infection if you get COVID. You don't know how effective natural immunity will be. You may get COVID again within a few months. You can still spread COVID to others, and it also has the long-term side effects of COVID. Okay, vraag 4. Verander dit jou DNA? En wat is in die inenting bevat dit werklik die fetus of a baby? Okay, this is a complicated question with a lot of different aspects to it. So I'll do my best here. So let's talk about the mRNA vaccine, because that's the one people are worried about, because they're injecting a little bit of mRNA, just to note, it's not DNA. And this is an infographic to try and help you understand how it works. I will give these slides to Phillip so that you can look at them at your own time. But really, it explains that, in short, it sends a message to the body. The body produces something that looks like a spike, and then the body fights it and it makes an immune response to it. And then that mRNA message breaks down. And a nice tweet that tries to explain it in a little bit in an easier way is an mRNA vaccine doesn't actually contain the virus itself. Think of it as an email sent to your immune system that shows what the virus looks like, instructions to kill it, and then, like a Snapchat message, it disappears. And it really is amazing technology. So does it change your DNA? Absolutely not. It never even gets into the cell, which is where your DNA lives. It talks to the outside messengers of your cells, and there's absolutely no way it can get into the cell to change any DNA. So please don't believe it. It's an absolute lie. Okay, so there's so much out there about this, and a very nice read here is on a website called Dear Pandemic, which is run by scientists from around the world, mostly women actually, and they speak in a much more informal blog type style about questions, and they have got hundreds and hundreds of posts. And if you go to the Dear Pandemic website, you can look up almost any question they've got, and they explain it in an easy to understand way with interesting graphs or graphics or explanations that help you to understand what the real science is. So like I mentioned, it never enters the nucleus of the cell where the DNA is kept. So no. In terms of what is in a vaccine, Okay, so you can go to the manufacturers' websites, you can go to CDC websites, and you can find out exactly what is in the vaccines. And you can also go to the Dear Pandemic website, and they will tell you exactly what's going on. The reason I'm showing you this is about the whole fetal cell controversy, and it is a little bit controversial from a Christian perspective, and I'll try and explain to you why. I don't have lots of pretty pictures for this, but I would highly recommend, if this is something that you're worried about, reading this one from Dear Pandemic, which I mentioned, and maybe also a view from a guy called Albert Mohler. I don't know if you know who he is, but he has a lot of posts. He is a Southern Baptist, so you'll have to forgive him for that. But really, this is looking at the Christian worldview. And let me just try and explain it, and I'll have to do it verbally because it's difficult to find scientific-based stuff on this, because people are not too concerned about this always in the secular media. So essentially what happened is that very, very many years ago, in the 70s, there was one baby that they got cells from, and those cells happened to be easier to grow. And that one baby was an aborted child, which is terrible. And that is not something that anyone will condone. And that is not something that we say it's worth it because of science. No, it's something that should not have happened, but it has happened. And what happened is that with those cells were much easier to culture. So that cell line, they just keep culturing those cells, but it's not a new baby that's aborted every time that they do that. It's the same baby, and they use the cells that are just grown. And usually what happens when you do that with cells, that after a while they die. And so some cells are just really good at being cultured. I'm not sure if you've heard about the story of Henrietta Lacks, but she was a lady with cervical cancer. And she was from a very impoverished area, and some of her cells were also very good at being grown in culture, and were then used for a lot of scientific work done in the future without any compensation to her, which led to a massive lawsuit. Essentially, the reason I'm telling you this is because the cells from that one baby worked very similarly. They didn't just keep dying. They were easy to keep culturing. And what happens is that some of the vaccines, not the mRNA vaccines, so not Pfizer, not Moderna, but the J&J does, use this line of cells. And just to note that there are billions of these cells around the world now, because these cells that are good at being cultured are being used as a standard among all the different labs. And what they do is that they use these cells to be able to make those viral vectors that are used to get the actual vaccine into the body. So the important thing to note here is that babies do not get killed to make these vaccines. There are no fetal cells in any vaccine. There are no fetal cells being, having to be made new or anything like that. Yes, that one cell line exists from the 70s, but I think that there are many things that are bad that have been done in the past, but that have had occasionally positive outcomes. And you can't throw absolutely everything out because of one bad thing that happened in the past. I'm perhaps not explaining it as well as I'd like to, but I would highly recommend that you read the second paper to have a good understanding of the of Christian ways of thinking about how these things are done. And the good that has come out of the technology for Ebola vaccines, for COVID vaccines, for so many vaccines out of this one cell line and this one baby that was aborted. To say that you will not use those vaccines because of the one baby is something that you'd really need to think about. And I would, like I said, recommend reading that second paper. So did I get the Johnson & Johnson vaccine? Yes, I did, knowing that it was that cell line was used from that line, because that was the vaccine that was available at the time, and that was the vaccine I had access to. And absolutely, I feel that protecting my brothers and sisters and loving my neighbor outweighed that consideration. But these are difficult times, and these are considerations that we need to be making. And I'm not saying that you must keep your eyes closed and not think about these things, but they are worth discussing. So, long story there, sorry about that. Okay, vraag 5. Hoekom spike die infeksie nog steeds al het so baie mense die inenting gekry? Okay, herd immunity. Herd immunity, you will see here. So say blue is people that have not been vaccinated and they haven't been vaccinated and they haven't been infected. Red is infected, yellow is vaccinated. So here in the first one, no one is immunized and contagious disease spreads through population. Some people are immunized and contagious disease still spreads throughout the population. If most of the population gets immunized, then the spread of contagious disease is contained. What numbers do we need to get to? About 80% of all people, not just 80% of adults. I know the Department of Health has been saying 60%, but I guess they were saying let's start small and let's get bigger, which is, I suppose, not the worst thing. But the other thing we need to look at is not just herd immunity, but how infectious something is. So the R0, which you might have heard people talking about, estimates how many people get sick if how many other people would get sick if one person is likely to infect. So this person is infected, and in COVID, with the initial strain, it was about 2 to 2.5 people. But that obviously differs depending on where you live, like for example, India. Zika is sitting between 3 and 6.5. Measles, incredibly infectious. Ebola, quite infectious, but the reason it doesn't spread more is because it kills too fast. HIV, quite infectious, but also depends obviously on the habits of the population. Your more religious populations will obviously have much smaller spreads. Seasonal flu, not as infectious. Norovirus, a little bit more. But in the current Delta variant, this number is probably closer to 16. So like measles. So why are people still getting infected? Because at the moment, 8 million out of 60 million is nowhere near enough herd immunity, and the Delta variant is significantly more infectious. What about in first world countries? It is spreading like wildfire through the unvaccinated populations. The ICUs are full of unvaccinated people. Okay, vraag 6. Ons het die reg om dit te weier. Watse gevare hou dit in om dit te weier? Gaan ons nou nie mag koop, kerk toe gaan ensovoorts? Okay, and my opinion on this is that Mark 12 says, love the Lord your God with all your heart and with all your soul and with all your mind and with all your strength. We all know this one really well. The second is this, love your neighbor as yourself. There is no commandment greater than these. And as a doctor, I have seen so many people that have been so sick. Most of us have had loved ones die. This is not a joke. We need to protect each other and we need to protect ourselves. We need to protect those around us. Masking up and getting vaccinated is absolutely our responsibilities. And the number of people that cannot get a vaccine because of some medical reason are absolutely tiny, 0.05% of the world's population. Are we going to be mandated to vaccinate? Well, in France this week, I don't know if you've been following the news at all, but President Macron has now made it obligatory for people to have vaccination passports to do non-essential things. So if you want to go to the movies or you want to go to the gym, you have to have your proof of vaccination with you. And the idea is, why must we restrict everyone's freedom of movement based on a few people that don't want to vaccinate? So the idea is, if you don't want to vaccinate, that's fine, that's your decision, but then we will restrict your movement to non-essential things. Obviously, they can still go to the shops and do any kind of essential things that they need to do. So it's already in the world and it may well spread, we don't know. If you look at Schengen visa news, to anyone who goes to the Netherlands, for example, or to any of the Schengen countries in Europe, they asked there, do you think COVID-19 vaccination is obligatory for travel is a good idea? 41% said yes, and this is a couple of months ago. This is not going to change. This is probably going to become more and more. At the moment, you can't go to any of the Schengen countries without proof of vaccination. And a lot of people feel this way. If they've been vaccinated, they don't want to take an Uber, for example, with a driver that hasn't been vaccinated. And it makes pretty good sense. You don't want to spread it to your loved ones either. Okay, vraag 6. 7, jammer. Wat se raad het jy rakende al die pop-up treatments wat daar gedeel word op social media, soos hydrogen peroxide? By the way, hydrogen peroxide will kill you. Wat ewe skielik soveel keer meer effektief is as selfs ivermectin, wat self nog nie helemaal bewys is as iets wat werk nie. En waar kan mens gaan om die regte feite te kry, eerder as om na Tannie Sari van Pit Sonder Water te luister? Okay, so just to note, ivermectin, it has received so much attention, and all of that was based on the one biggest study that was done on ivermectin, which was later withdrawn because it was found to be fraudulent. Fraud happens everywhere. People are people. And they found that a lot of the participants, so-called, had exactly the same blood results and were all given the same treatment on the same day and lots of other dodgy things. And it turned out that they fabricated most of the patients in that trial. And since they withdrew the data from this ivermectin trial, all of the rest of the data has actually since fallen over. It is no better than placebo. If you have an infestation of worms, ivermectin is fantastic. It is not good for COVID. The problem with ivermectin is not so much whether it's good or not for COVID. It's that in South Africa, ivermectin is a veterinary medicine. It's not actually compounded for humans. And the people who've been selling ivermectin have been compounding it in sometimes dodgy areas. And when they tested that ivermectin, they found contaminants in more than 60% of the doses that they found that were being sold to humans. They had heart medicine in it, they had sleeping medicine in it, they had antibiotics in it. So if you are ordering and taking ivermectin for whatever reason, you do not actually know what's in there. That's the first problem with ivermectin. The second problem with ivermectin is that people believe that if they're taking ivermectin, they are not going to get that sick. And then when they do get sick, they don't seek medical care quickly enough, and they actually end up dying from COVID or having bad effects because they didn't get oxygen quickly enough or get the life-saving treatment that we now know works in a lot of people. So please do not use ivermectin. Hydrogen peroxide. I was listening to a webinar from one of the most well-respected pulmonologists in the country, and he said hydrogen peroxide will stop you from getting COVID. Why? Because you'll be dead. It causes a massive inflammatory reaction in your lungs. Basically, it burns the inside of your lungs and it kills you. Please do not use any of these pop-up things because there is no evidence for it. There is hospital doctors and most GPs follow whatever the latest relevant research is. So if they say take these vitamins or whatever, go for it. Absolutely. But please do not take it upon yourselves to try these other things. When COVID first started, the idea was that if you take, what is it? It's a malaria drug. I can't remember what it's called now. But if you take it, then you will be highly protected. And in the clinical trials, it actually showed that more people who took it died than those who didn't take it. So these pop-up medicines have side effects. In fact, they've got more side effects than the things that you are scared of. In terms of where to go, if you want to know where the trustworthy sites are, if you want to just look in general places on the internet, I can highly recommend this page called Dear Pandemic. They really have some really great and well-written articles that are easier to understand. The World Health Organization and CDC obviously also have great stuff, but it's a little bit more difficult to get through. And the NICD in South Africa have great updated stats if you want to know what's going on in our local situation. If you're on Facebook, there's a South African scientist called Mistress of Science, and she gives nice summaries. There's a nice South African Facebook page called Vaccination, and there people who've had their vaccines talk about their experiences. It tells you which walk-in sites have short queues, and it tells you which sites you can choose if you want Pfizer or J&J and what's going on out there. And there are so many more. Generally, all these will link to other ones that are good too if you're looking for even more information, but this should get you started if you are interested. And that's it from me.
Pauline, baie dankie. Dit was nou 'n mondvol gewees. Ek waardeer regtig jou tyd. Een ding wat ek net, een of twee opmerkings wat ek net wil maak rondom dit wat jy nou gedeel het is, as jy nou na hierdie video kyk, kan jy duidelik optel, sy praat die waarheid en sy steek nie enige feite weg nie. En ek dink dit is wat vir my lekker is baie van die moeilike vrae wat sy beantwoord, sy het die feite op die tafel gesit en gesê, ons kan nie skaam wees vir die metodes wat ons gebruik het om by sekere goed uit te kom nie, maar dit is die feite en dit is waarna toe ons gaan. So ek waardeer dit. Ek waardeer jou tyd. Dankie dat jy eerlik is. Ek dink die wêreld het meer die gesprekke nodig op hierdie stadium as wat ons gesprekke nodig het waar ons sê hydrogen peroxide maak COVID dood, wat nie bewys is nie. So baie dankie daarvoor en ek dink ek wil net op hierdie stadium ook net 'n disclaimer hierby sit, dat sy het vanaand geen mediese advies vir enige spesifieke persoon gegee nie. So as jy siek is, moenie haar raad volg nie, gaan sien jou dokter dadelik. Moenie wag nie, ek dink dis een ding wat sy gesê het, moenie wag voordat dit te laat is nie, en ons sien die navorsing wat wys dat ons in die regte rigting beweeg, en ek dink een van die dae gaan ons meer antwoorde hê op al die vrae wat daar is. Ek weet nie of jy 'n laaste opmerking wil maak rondom dit nie, en dan kan ons mekaar groet.
Just to say that I think there's double as much false information as there is true information. And in just the first 12 months of COVID, the COVID research is almost 10 times any other subject out there. It is being incredibly well researched. If a scientist says something and then they say something different the week later, it's not that they're an idiot, it's that they are following the science and they are honest enough to say, we do better when we know better.
Dis hy. Dankie, ek waardeer dit, ek waardeer jou tyd en ek wil ook sommer net namens al ons nie mediese mense daar buite kan sê, dankie vir die moeite en die tyd en die sacrifice wat julle dit insit. Ek dink ons sien in die hoofstroom media, sien ons wat se tol dit, as ek dit so kan sê, op die healthcare professional sit, en dankie vir julle sacrifice, en dankie vir die tyd wat julle insit, en dan nog 'n tyd uitsit om hierdie vrae te beantwoord. So ons waardeer julle, en baie dankie daarvoor, en mag jy 'n lekker aand verder hê, en soos wat ek vir Martinus gister gesê het, mag jy gebuig loop onder die seëninge van die Here elke dag in jou lewe, en sommer vir jou gesin, en jou familie, en almal wat ek nie eers ken nie. Maar dankie daarvoor, waardeer dit.